Hello, and welcome to the National Student Nurses Association Conference. We're very excited that you're attending this conference, and we're really excited as well that you're attending our session that we're sponsoring today from the Board of Certification for Emergency Nursing, or as I will refer to us going forward, BCEN for short. We're going to be talking to you today about emergency nursing careers and specialty certification, from flight suits to scrubs. Let's take a look at what we're going to talk about. I'm going to be giving you a brief overview about what BCEN is, who are we, and what do we do. Then we're going to get right into the meat of the presentation, and we're going to hear from our panel members, and then there will be time for Q&A at a different session, which we'll talk about later. So a little bit about BCEN. We've been around since 1980. We are a not-for-profit organization. We develop and deliver specialty nursing certification exams for nurses who work in the emergency spectrum. So that's your emergency departments, your flight programs, trauma units, the trauma continuum for trauma patients, and ground transport. We also have a specialty certification for nurses who work with emergency pediatric patients. Our certification exams are accredited and nationally recognized. They are based on current U.S. standards, and we are the benchmark for nursing certifications across the emergency and trauma spectrum. Let's talk a little bit about the value of certification. Now, we do recommend people have 2 years of work experience. It's not required, but it is recommended before you sit for a certification exam. And that really does hold true no matter what specialty you're going into. The value that certification really gives you is that it establishes a proven level of clinical knowledge and expertise. It requires participation in lifelong learning. You do have to study and know a lot to pass a specialty certification exam. And to maintain that specialty certification, it does require lifelong learning because you've got to maintain that expert knowledge base. It also promotes professional development and career advancement. Oftentimes, people with specialty nursing certifications are chosen first for special projects and promotions and advancements in their career. It provides employers, patients, and peers a mechanism for recognition. Many nurses wear their specialty certification proudly on their work badge or on their uniform, and that gives the patients a chance to ask, what is a certified emergency nurse? And you get to tell them that you are a certified emergency nurse and what that level of expertise means as you've passed that exam. And it's also a way for your employers and your peers to recognize that you have risen to the top of your career, of your profession. It also promotes self-confidence and self-efficacy. A lot of our nurses will tell us that they are much more confident after passing their certification exam, and they're very, very satisfied that they've done that, very proud of that. And we know from the literature that specialty nursing certification absolutely impacts patient care, safety, and patient outcomes in a very positive way. At BCEN, we are proud to let you know that we have 57,637 nurses that hold one of our 5, or some of them hold more than one, of our specialty certifications. It's very exciting, and that's growing all the time. And we're very passionate about making sure nurses have the opportunity to sit for their certification exam, no matter what specialty they're in. BCEN also has a platform called BCEN Learn. This is fairly new for us. We launched it in 2020, and this is an area that you can go to on our website under the Learn tab, where you can find continuing education to promote that lifelong learning we talked about a moment ago. So you can get continuing education through courses. We have practice exams. When you're ready to sit for your specialty certification, you can use one of our practice exams to help you prepare. You can also get CEs for completing practice exams. And every month we do a free webinar that also allows you to earn a CE. And those webinars have all kinds of relevant topics, and they're a lot of fun to listen to. We have a great response to those, and they are really fun to engage with. And then on top of that, we have the BCE and Friends podcast series that you can download on any device. And you can listen on any app that you would normally listen to podcasts on. So I hope that you'll search out BCEN and Friends and listen to some of our podcasts. We've got some really great conversations that we've had with many interesting people. So it's just thought-provoking and sometimes educational topics on our podcasts. I'd be remiss if I didn't mention the BCEN Advantage program. This is a program that we launched in 2020 to help student nurses or nurses new to the emergency setting that want to work in the emergency setting to give you an advantage or a leg up. The competition can be very stiff when you're competing for a job in the emergency department. So this program that you can complete allows you to go to your interview and demonstrate your motivation, your commitment to emergency nursing, that you've gone the extra mile by completing this program. And it begins to give you some of the skills and knowledge that you're going to need specifically to work in the emergency department. This program in no way replaces your orientation or your onboarding, but it absolutely gives you a leg up, and it's very exciting. Some of the requirements, just quickly, for the program, we ask you to complete a Stop the Bleed course. There's a community volunteer event commitment. We ask that you have a current CPR certification from the American Heart Association. We ask you to do some courses like the Emergency Severity Index. There's a couple of FEMA courses on here, the NIH Stroke Scale, and Emergency Nursing 101. There are 3 essays to write. We ask that you belong to a professional nursing association of your choice, and we ask for proof of active participation, and we ask you to upload your resume. These are the program requirements for Advantage. You have 12 months to complete it, and the cost is very low, but it gives you a huge leg up on your competition when you're going to get a job in the emergency department. Some of the things that you receive, tangible things that you receive when you complete our Advantage program, is you do get a digital badge. So you can display that on your email signature. You can display that on your LinkedIn profile. You can share it out on Facebook or any of those social media platforms that you use. You also get a certificate from us showing that you have completed the program, and you get this lovely portfolio that you can put all your program accomplishments in. So when you complete Stop the Bleed, or you write one of those essays, and one of the essays talks about, tell us about a clinical experience that you had that made a significant impact on you as a nurse, or tell us about an operational issue that's common in the emergency department, and how would you go about solving for that? So you can point to these essays or these different requirements that you've completed in the Advantage program, and you can discuss those with the person who's doing your interview. And I tell you, it's pretty darn impressive. On our website, we have a students page, and you'll find this is a journey map that students or new nurses to emergency nursing might take as they look to get into the career of emergency nursing. So we have a lot of support and resources and aids for students, and you can find all these on our website under the student section, which is also where you'll find our Advantage program. So I hope you'll check it out. I do want to let you know that BCEN is very passionate about investing in the future of nursing, and we're very passionate about lifelong learning. And so to that end, we do contribute every year to make sure nurses have opportunities for scholarships, nurses and student nurses. So every year we give $35,000 to the National Student Nurses Association Foundation. We do the same for air and surface transport nurses. We do the same for Society of Trauma Nurses. We also give to the Emergency Nurses Association. So we're very, very fortunate to be able to invest in your future as you further your education. So I will end most of my comments here. Certification and lifelong learning, do it for you, do it for your profession, but more importantly, do it for your patients. And now, if you'll take just a moment, pick the social media platform that you really love the most, or maybe pick all 3 of these, but you can find BCEN on LinkedIn. We are the Board of Certification for Emergency Nursing. On Facebook, we are the Board of Certification for Emergency Nursing. And on Instagram, we are BCEN Certifications. And I would really appreciate it if you'd follow us on one of these or all of these, because we'd really like to stay in touch with you. And we want to make sure you know what's going on as you get into your career in emergency nursing. So without further ado, I'm going to introduce our very first panel presenter. His name is Stephen Talbot, and he does hold the certified emergency nurse, and he is a trauma certified registered nurse. And he's going to talk to you about his career and his path to certification. Stephen, take it away.
Well, thank you so much, Janie. It's an honor to be here today. For everyone, my name is Stephen Talbot, and I am one of the CENs. I am currently the trauma program manager as well as the clinical manager over the operations administrators, the sitters, and our COVID screening stations for a large healthcare facility in Houston, Texas. I first became an RN about 18 years ago. I initially was a paramedic and then received my BSN from McNeese State University in Louisiana. And so why nursing? So I can remember as a very small child, one of the first things that I drew in nursery school was a person holding a syringe. So I think it was kind of driven from instinct, maybe, I don't know. And then my grandmother, as a very small child, suffered from cancer. This was back in the 80s when treatment was nowhere near what it is now. And my grandfather essentially took care of her at home. So I watched this. I watched her port access. I watched her port being changed and her medications being given. And so this also drove me to want to become a nurse even more. So discouragement, there will be discouragement along the way. It came from nursing school. It came from one of my professors who did not appreciate paramedics continuing their education. But if you study hard, you focus, you prove to yourself you can do it, you can do it, you can get through there and then join the nursing workforce. So my path to emergency nursing, so I started off as a new graduate nurse in the emergency department. I have 18 years plus in emergency medicine. And one of the things that I like about emergency nursing is that, one, it gives you the excitement of the unknown, but you have new opportunities for different things. And then every day is different. So every day, a new patient, a new shift brings that kind of sort of excitement and the unknown to emergency nursing. The most rewarding part of my job, I would say, is being able to have an impact and save someone's life. You have the ability to pick up a very mild clinical symptom or sign that can be life altering for someone. You know, as nurses, we hear compassion and we help people, but really you are that person that's that advocate for the patient. You're helping people, and we're changing every day. We're evolving. Especially over the last year with COVID, we know that we have had to, as nurses, adapt. We've had to change our work patterns. We've had to perhaps work longer hours. We have staff that are leaving to go do travel nursing. And so it's being really able to adapt over the past year as we have had this pandemic since early March, late February of 2020. So tough days ahead. So yes, ER nursing is not glamorous like you see on TV. There are some people that are just in the wrong place at the wrong time and have life-altering injuries because of that. Some people just make poor decisions. And so I think one of the most difficult things in emergency nursing is that you're going to see death really up close. And you're going to see horrible things that happen in society. You're going to see child abuse and elder abuse and sex trafficking and all of these things. So it can be really emotionally draining someday. It can be physically draining as well because you are on your feet sometimes for 12 to 14 hours a day. So it is not for the faint of heart. There are some really tough days you will experience in the ER, but I think overall, knowing that you can make a difference in some of these people's lives is really a special place to be in society. So I first heard about BCEN as a new nurse and thought, I definitely want to achieve this. I wanted to learn as much as I could so that I could proudly have CEN behind my name. And so why did I achieve BCEN certification? Well, one was to prove to myself that I had the knowledge to actually take this national exam. Like, wow, think about that. You have a specialty set of knowledge that you can actually put on paper and then have some credentials behind your name that shows you are an expert in your field. And then the other thing was I wanted to prove to my coworkers that I knew what I was doing. So in 2009, when I took the CEN exam and passed, I was the first and only nurse in my emergency department of a 42-bed emergency department with over 100 FTEs. I was the only nurse there that had my CEN. So that was extremely proud for me to show that I had gone above and beyond passing the NCLEX and that I had put some professional credentials behind my name. So preparing for the exam, so months before the exam, every morning after work, because I worked nights back then, I would actually study with emergency nursing text. I did attend a review course. I will tell you that typically, if the only thing you're going to do is take a review course, that's not going to suffice to pass one of these exams. You've got to know the knowledge, you've got to practice it. And so practice exams and questions, practice tests are a really great way to see where you fall in that spectrum and how you're going to perform. So certification impact. So one, it's going to build confidence. I was, like I said, the first ER nurse at my facility to achieve the CEN, which over the years has inspired others to go ahead and get that certification. And so one thing we can do once we achieve that certification is we can encourage others. We take that knowledge and we try to get others to go ahead and do that. I truly believe that we provide better patient care by getting our certification because of all of the continuing education that we need to maintain the certification. So, a lot of states require you to have 15 or 20 hours every 2 to 3 years, whereas professional certifications typically are 100 plus hours of continuing education every 3 to 4 years, depending on what their recertification timeframe is. And so we possess further knowledge, further ability to care for our patients based off of all of the continuing education that we possess in order to maintain our certifications. So my employer definitely values certification. I've been at the same employer since 2008, so really grown at that facility. And so 100% of certifications are reimbursed at my facility. The emergency department houses books and practice test books to be able to check out for the ER nurses. We have something called CE Direct. So there's different review modules, there's certification review modules in that platform that's available to all nurses in the facility. And then once you achieve your certification, one of these recognition things that my VP of nursing does and has done for several years now is that she actually buys a jacket for everyone that gets their certification, and it's got your name and your credentials on the jacket. So you can proudly wear that while you're at work. And we have seen that just that recognition has encouraged others to get it because they want the jacket. What they don't realize is that they're getting further knowledge at the same time. We're also a magnet facility, so magnet facilities have to have a specific percentage of nursing staff that are certified, and then in management, it is required. So as a manager or above at my healthcare facility, it is actually required to have a professional certification. So benefits. So like I talked about the CE hours, so we stay up to date on the latest treatments, the latest therapies, all of those healthcare trends, and being in the forefront of knowledge. So this is especially true over the past year when we look at COVID. There's a lot of things that ER nurses have been doing, especially with hold times in the ED, holding ICU patients. In some states they were holding ICU vented patients for 2 to 3 days in the ED. And that's not something historically EDs have done. And so there's a whole new skill set that we've had to learn over the past year of taking care of these really sick COVID patients, proning patients on vents for extended periods of time. And so by maintaining CEs, you're able to do all these things and be the leader in that department to assist other staff in doing these therapies. So emergency nursing in general, we are empathetic, you're very caring. We want to be mentally stable and realize that we can't let things get to us. Very quick decision making, really good time management, and remaining calm. So someone is coming in the middle of their chaotic event. So we have to be the one that remains calm with clear, concise, really good communication. So stress comes along with being a nurse, but really comes along with being an emergency department nurse. And so some of the things that I recommend that you do is find something that you enjoy that you can actually do to relieve your stress, whether that's exercise, whether it's prayer, whether it's going to the gym, spending time with friends and family. I particularly like traveling. I like hiking. And so those are some of the things that I like to do because you really have to disconnect and find some time for self-care. And so I would advise you as a student to take advantage of clinicals in the emergency department. Also, I would also highly recommend getting involved with your professional organization. Students are always invited to our professional organization meetings at the local level. And I know some particular ER directors that when they are looking to hire people, and they may only be able to hire 2 people, but there's 30 applicants. One of the things that will give you an upper advantage is being a member of your professional organization. Well, I want to thank you very much for having me speak with you today. And the next presenter is Stephanie. So I'd like to give Stephanie a warm welcome.
Thanks, Stephen. I wish I would have heard that presentation back when I was looking for my CEN. Hi, everyone. My name is Stephanie Susedale, and I'm going to be chit-chatting a little bit about the CFRN. So as you can see, I have a whole lot of alphabets here. Feel free to read them at your leisure. So let's talk about kind of how I became an RN. It was a really long journey, kind of like one of those 6-year RN kind of deals. I was not a 4-year RN. I did get my bachelor's degree from Pennsylvania College of Technology. That is an affiliate of the Penn State University. I went on to get a master's degree from Duquesne University, and I'm actually pursuing a second degree in more of social media marketing and health campaigns. So you can kind of do anything you want to put your mind to. I completely changed kind of like where I'm going in school. So why nursing? Oh, that's a fun story. My family was like always in and out of the hospital, emergency rooms. My dad was he owned his own business and did construction. So he was always kind of getting into trouble. So we always called him Humpty Dumpty because if it could be fallen in any direction in regards to another thing, on, off, under, around, he did it. And, I always made the joke that I was kind of a field surgeon by the time I was 16. So I learned how to do sutures and all kinds of things, obviously under the radar. I don't recommend doing sutures at 16, but I was doing them by the time I was 16, just kind of patching him up and sending him on his way. And that really kind of made me interested in kind of some of the healthcare things. And I went on to be a lifeguard, one of the first lifeguard classes actually at Hershey Park. So if you're coming up in through the nursing school world right now, you are no stranger to adversity, and I commend you on that. You've been handed a lump of coal and you're turning it into a diamond. This was vastly different than when I went through nursing school. So I am not a stranger to being handed this lump of coal because my life is kind of like one of those things that if you're familiar with Pennsylvania, you're familiar with our roads. I have had more bumps in my road of life than a Pennsylvania road. So one of the things I started is I actually didn't even start in nursing. I became an EMT first. And I didn't even become an EMT on the first try around. I went for EMT classes after I went through a really devastating breakup, that first big love of your life. And I failed the class the first time around. And that was kind of devastating. But then I went back, I took it again and passed at one of the top of my classes. So then I was thinking, I want to go to school. Maybe I want to go to be a nurse. And then I kind of got one of those ego things where I don't want to be a nurse. I want to be a doctor. So I went for pre-med. Literally, guys, after taking 48 credits in the first year, I failed everything. I got maybe like 4 credits. And yeah, that was a real kick in the teeth. I just had a lot of struggles in my life. I dealt with just an assault very young at like 13, 15, things I'm still kind of haunted by at age 30. And I've had a lot of struggles with mental health, anxiety, depression, bouts with suicide, things that just those things you don't want to talk about. But, they made me stronger and more empathetic as a nurse. So path change, I just 180'd my life and I really buckled down. Applied to Penn College as a paramedic student, knew I loved emergency medicine. I loved it as an EMT and thought, I want to go be a paramedic. It lasted about a year. Okay, so year 3, finally I figured out, want to be a nurse. 4 years later, I graduated. And every year my grades got better. Just kept pushing. But during nursing school, it was just a mess. And I'll tell you a little bit more about that in a minute. But what it came down to is just, you've got to persevere and you got to keep that kind of goal in your sights. And through just support of my peers, my support network, my instructors, that last semester I finished with a 4.0 GPA. So flight nursing, this is where everyone kind of like, ooh, flight suits. It took a long time. So from the time I was like in teenagerdom to now, I've now been a flight nurse going on almost 3 years, and started in EMS around like 2006 and became an ER nurse in 2015. I did not get my first ER job right off of graduation, and that was devastating. I started in the ICU and it was just not for me. I just didn't have that passion for it. So I applied again and I got it, and I just succeeded in there and I loved it. I loved everything about ER nursing. And I applied for flight jobs. No. I just kept getting told no until finally I got 2 yeses. And I was just like, happy dance. But the thing about that is just sometimes you get told no, sometimes you get told no and no and no. So what's rewarding about my job? Oh, the adrenaline. ER nursing is nothing if not unpredictable. It is chaos. It is controlled chaos. Some days it's uncontrolled chaos, but it's just kind of learning to be that calm, cool, collected in that chaos. I love the adrenaline. It's that kind of interfacing with your community. The ER is the door to the hospital, to the community. It's more than just, putting a Band-Aid on something or fixing a gunshot or what have you in the ER. Emergency medicine is really a sense of we represent medicine because we do things like, how do we prevent injuries? As a flight nurse, I do a ton of public relations. So I go out and I talk, I show up in my big spinning, whirling, whirly bird, and people go, ooh, ah, and, but it's a really big sense of just, I want to be like that. And women especially have notoriously been underrepresented for decades in emergency medicine and in senses of like first responders and military. So when little girls see women show up in flight suits, they're just like, and that's just the coolest feeling. So people look to the skies and they're like, man, I can do that too. And I think that everybody should have that sense of no matter what happens in your life, you can too just sprout wings and show up, because if I can do it, a lot of people can do it too. And I think the final thing is just being that cavalry and that sense of relief, not just for our patients, but for our colleagues. I'll show up in rural ERs and I'll see the ER nurses who maybe are just a little over their heads, and you can just see that kind of, man, that is a relief. That is like a relief to them when we show up. And that to me it speaks volumes. And that's a profound impact because they trust me. And, some days I don't even know what I'm doing. I'm just like, I don't know about all that, but I know who I can call. I can call back to my med command and they'll know what I can do with that. But, outward, I'm just kind of like, I got that. Mm-hmm. Yep, we got this. No worries. We're here. And that calm that I portray calms down my colleagues and calms down the patient and calms down their family. So that sense of relief that we can kind of convey to other people is almost like contagious. And that's cool. So even if I'm kind of like, inside, it's that we got this inside. And I think that's pretty cool. So is it all easy? Is it all fun and games? Absolutely not. It's a picture of me. So I've had a history of seizures, and this was me when I got the all clear, I can drive again, EEG. So sometimes, and this is something that I think as nurses, we just have to understand, is we are the gatekeepers between the good and the bad of our patients. We are charged with immense responsibility. Decisions that we make a difference, and we have to understand that every little thing that we do profoundly matters. I think sometimes we don't really sit back and wonder if we honor the work of the nurses before us, if they would be proud of where we are. So if you come into question if your ethics or your decisions or your behaviors, one, would your family be proud? Would your patients be proud? Would you be proud? Would Florence be proud? What would Flo do? That's the new saying. What would Flo do? Besides open windows and do the whole miasma theory. But at the same time, like what we do matters. It's as simple as holding somebody's hand who's scared for like a hot 5 seconds. Sit down, hold their hand. Explain what you're doing. Ask for permission to touch somebody. I can't tell you as a patient in and out of hospitals, and again, having had the abuse history, how traumatizing it has been for me when people don't ask to touch me. They just kind of like come and paw on me. It's traumatizing, guys. Those little times that you ask, may I, make a huge difference. We don't know what people's circumstances are. So staying positive and resilient, that has saved me and made a huge difference. So life's going to knock you down. Don't let it. Rely on your coworkers. They're your team. And just be honest with yourself. If you're not good at something, ask for help. Don't try to cover it up. And I think if anything, my exams that I've gone through have really helped me understand where my weaknesses are. And if anything, the BCEN certifications really make it very evidently clear where you need to work on, which is fantastic because I have worked on them. And there's no shame in admitting, hey, I'm not really good at this. But when you're preparing for your exams, whether it be NCLEX or it be an NP exam, or it be any of these BCEN exams, how do you prepare for that? Well, get into it, dig in, get your hands on, go to review courses. Sometimes it's a matter of sitting in a room with other people who have questions you may never have thought of. Read books, lots of books. But the thing is too, is with reading books, understand that many of these exams are not looking for you to read and regurgitate. They want you to apply. Pull from the experiences you have. Hey, that one time, I remember that. Pull from it. And then look at the actual outlines. Those outlines are there for a reason. Don't ignore them. So why did I go for certifications? Well, other than the fact that I got a cool jacket with like all the things on it, because I got all 5. I did it more because I wanted to open myself to new career opportunities. Like doors open left and right when you have all these certifications. But I also wanted to kind of develop myself, challenge myself to something new. I wanted to show people that I'm not the bare minimum. I'm a go-getter. I wanted to show people that I'm competent and I know my stuff. Broaden my understanding of those things that not just that I know, but that maybe that I'm weak on. And I wanted to be that person that people were like, she knows her stuff. But it's just like the foundation for everything that you know, whether or not you have critical thinking or not. So again, my patients know I know. And the thing with the tests is they're tough. They're not easy, but they can be done. It's a lot of information to know. But when you get these exams and you pass the exams, it's the best feeling in the world because you're like, I knew that. I knew all that. Look at me. I knew that. And that's awesome. And the fact that you have to keep, so much continuing education for these, it just keeps like that knowledge in your head constantly. So the thing with my employer is the way the flight service usually works is they want you to come in with at least one. My particular employer wanted me to come in with a minimum my CEN, as Stephen was talking about, or my CCRN if you were coming from like an ICU setting. So I had already come in with my TCRN and my CEN. And since then, I've gotten my CFRN, my CPEN, and I just got my CTRN here in December. But, employers like certification, especially if they're a magnet hospital. Many will offer reimbursements, et cetera, et cetera. So as far as actually maintaining it, CE requirements are about every 4 years. But again, as I said, this really kind of keeps you up to date. And I think that the more certifications I got, the more doors opened for me. What was kind of cool is that, having these certifications and even not even having them all, but just kind of chasing after them really opened a lot of opportunities for me. Namely, the fact that I became an Insta crew member or a social influencer for a BCEN. That has opened up so many opportunities for me. I've met some of the greatest people I could ever have wanted to meet, had opportunities to speak to you here today, just be involved in things bigger than myself, and which is super satisfying, help coach other people. It's more than just ourselves. And, people come to me constantly asking how to prepare for exams, and it makes you feel awesome, and it polishes you it gives you a shine. I just has always been just really satisfying for me. So characteristics: be flexible. Don't be rigid. Be funny in that you don't have to be funny. Just have a sense of humor. Laugh things off. It will help you. Be resilient. Recognize what is important and what isn't. Really be assertive. If you have something to say it, and always be an advocate. Exercise, rest, be healthy, hydrate, and talk about things that bother you. These are really important for self-care, especially in the emergency arena. So my final advice for you as emergency nurses: be the willow and not the oak. This means be willing to bend, be willing to flex. Don't be rigid. And finally, never say no. No doesn't exist to you. Simply say, not right now. Thank you. And I'll see you next from Brody.
Thank you, Stephanie, for that great information on the CFRN exam and flight nursing. Thank you, everybody, for being here and tuning in to listen to us share our stories and talk about certification. My name is Brody Ike. I am representing the TCRN exam, the Trauma Certified Registered Nurse exam, which is still fairly in its infancy. It's kind of gaining into its adolescent stage, but we are I'm very proud of this exam. I've been a nurse for almost 15 years, kind of went a different path. I started with my bachelor's in psychology, got an MBA, specialized in healthcare administration, and then went back to nursing school. I had worked in EMS and fire prior to all of this, so I actually worked in the hospital as a medic. But I kind of thought I was going to go to med school, then that changed, and I thought, well, I'll just be CEO of a hospital, and then that changed. And I kind of always knew I needed to stay clinical because that was my passion. And so I went to Columbus State Community College in Columbus, Ohio, got my associate degree, my 2-year registered nurse. That was an online program that had just started. You had to have a bachelor's degree in something else before you could join that program. We also were on quarters back then. I know most places are on semesters, so it was actually a fairly quick program. And then I got a job with the hospital that I had always said that was the only hospital I'd ever work at. That was Grant Medical Center in Columbus, Ohio. And while I was at Grant at Ohio Health, they actually are a very big proponent, and they push education and certification. So they actually paid for my BSN. So I finished my BSN while I was working, which was nice, and that was 100% online through Ohio University. I became a nurse. The inspiration for me becoming a nurse is actually my grandmother, which these pictures are her from when she graduated in 1950 on the left, and then her standing at bedside in the ICU that she actually helped start in my hometown. She worked her way up to what we would call a CNO nowadays. Back then she helped create the intensive care unit with the other physicians. She was very active in the community. She sat on a lot of boards. She taught paramedics. She was a medic herself. She won an award from the Ohio Nurses Association. I actually got to read this article from 1975, I believe it was. And she really talks about how she wanted to see nurses step up and really take control of their own knowledge and being able to grow that knowledge and their skills to help take care of those critically ill patients, whether it be in the trauma bay, in the ER, the ICU. I got to visit her a couple of times, and the one time that I did visit her, there was a situation that some people would find very chaotic, and just to see how calm she was, how she spoke to the physicians with confidence was really eye-opening to me, and kind of instilled that passion for the clinical side of medicine to me. Trauma nursing and emergency nursing, critical care, one of the fun parts of that is when knowing that someone can come in broken, you can fix them and send them on their way. I don't know how old some of you are, it depends on your age, but if you've ever seen the show Trauma Life in the ER, or just the show ER, those were big inspirations for me as well. I actually was on a couple episodes of Trauma Life in the ER when they filmed at my facility in Columbus, Ohio. My path to trauma nursing, I've always been a trauma nurse. I have worked in, my very first job was in a trauma ICU, a trauma surgical ICU, and we would float to the trauma intermediate care unit, which actually was very high acuity. They took ventilators and drips on the step down unit. And after about a year in the trauma ICU, I knew I wanted to see things from a different perspective as well. So I cross-trained to the ER, and I worked full-time in the ER and then would pick up working in the ICU. So from that moment, my entire career, I have done both critical care and emergency medicine, and primarily in all trauma centers. I started doing some travel nursing, and when I would travel in the ER as a contract, I would work in the ICU per diem and vice versa. I did a little stint in interventional radiology, which gave me a different perspective on some of the care that is required for traumas. You know, when you have that little bleed, an arterial bleed, something like that, the IR docs can come in and work their magic and embolize these patients, and it really is very, very crucial to trauma care. Interventional radiology is. I would take trauma call. Sometimes I would forget that I was on call, and I'd be working the next day at 7 a.m. and I'd get a call at 3 a.m. to come in and embolize a trauma. But it was well worth it. It gave me a nice change of pace. I moved into trauma education. I really love the idea of being able to educate new nurses on trauma and the whole spectrum of trauma. When asked about the most rewarding part of my job, trauma can be very rewarding. Trauma can also be very devastating when you see pediatric trauma or senseless trauma, as you call it, where an accident happened and now you have to try and save that life, and sometimes we're not successful in trauma, right? Nobody leaves their house expecting to get into a car accident that could leave them permanently disabled or permanently, loss of life. This picture here was one of my little 15 minutes claim to fame back at Ohio Health. We did a photo shoot in the trauma bay. I got a lot of grief for not having my mask up like I was supposed to, but I wanted to make sure they could see my face. So this is a poster that we would do at our EMS conference every year. Probably really rewarding part is you get this when you see your trauma patients that were really maybe a really major trauma, and then they get to walk out. Those are the ones you remember. The patients that came in as a traumatic arrest and somehow through great care and luck and faith, whatever, they have walked out of the hospital and they have full function. Some of the really negative parts, obviously, like I've already talked about, is you see the aftermath of trauma when an entire family is involved in a car accident and only one of the family members survive, or you have to discuss and talk with families about what their quality of life is going to be for their loved one after these traumas. They lose their limbs. The PTOT side of things, a lot of people don't necessarily look at that as being, especially if you're a trauma nurse, you don't necessarily look at that as the exciting part, but that is such a huge part of regaining function for these traumas. Pain control causes a lot of opiate addiction. We've gotten away from just throwing narcotics at patients. We try and do what we need to do to control your pain, but we're also know that there's probably going to be a certain level of pain you're going to have to, that we all are going to have to deal with, right? And that helps to try and decrease that rate of opiate addiction that we used to see years and years ago, because we would just give you so much narcotics that then, it would cause it was kind of a contributing factor to a lot of opiate addiction. Mental health issues, there's a lot of depression, PTSD, things that you have to deal with after trauma that you've been involved in a major trauma. Some people, after getting into a really bad motor vehicle crash, they have trouble thinking about driving again. People, certain things that happen to you cause stressors, and that's part of trauma nursing, is making sure that those issues are dealt with, right? So in economic issues, you lose your job, you can't work, you go on disability, maybe you are the sole provider for your family. These are things that you see as a trauma nurse when these things happen. Pediatric trauma and pediatric non-accidental traumas. The non-accidental traumas are what we call when you see potential for abuse, or where it's been something that's caused by a caregiver. So those are really frustrating and very sad. Any pediatric trauma, any trauma is sad, but especially when we're dealing with the little babies and the children, it's very taxing on you as a trauma nurse. And then obviously comforting families when withdrawing care, notifications of death. These are things that you will deal with more probably in the ICU as a trauma nurse than you would necessarily in the trauma bay. The trauma bay, you'll deal more with the notifications. So if someone's a traumatic arrest and they don't survive, then sometimes as the nurse, you will go with the trauma surgeon and a chaplain and social worker, whoever your facility wants you to be with, and you'll deliver that news, which is devastating to a family, considering a lot of times, like I said, they gave each other a kiss and saw their family member walk out the door, and then now all of a sudden they're no longer here. So the TCRN exam is, like I said, is a passion of mine. There's certification exams for every specialty, just like as a physician gets board certified, a nurse can get board certified. These are great tools to help validate your knowledge. And a lot of people avoid the exam because they don't want to prepare for it. They get nervous. So there's multiple review courses out there for each individual certification. I hear great things about most. Since I sit on the exam construction and review committee, which means that I'm part of the committee that reviews every item on the TCR exam. We help develop the content outline. I tell people, to take a certification exam, we kind of expect that you have a certain amount of experience. So some nurses get in and they hear about these exams and they really want to take them. And I know some nurses that have taken some of these exams with very little experience and they pass it. They know how to study. But in my opinion, if after 1, 2, 3 years or more of experience in the specialty that you're talking about, especially like trauma, you should already kind of have a strong base of knowledge. So one of the big things that you should do, and I always recommend, is just doing question after question after question. Same thing with the NCLEX. When I always tell people, you've got the knowledge, you just need to learn how they ask the questions, what kind of answers they're looking for, how they structure the questions. And so by just answering question after question after question, if you miss it and you look at the rationale, you're also learning at the same time. So you're reviewing that information that you don't know already, or that you might have forgotten, or that you haven't really had exposure to, because not everyone is going to see the same type of trauma as someone that works at a trauma center on the beach might see a lot more drownings than someone that works in the trauma center in the desert, And then the hospital support. My hospital was very good about promoting and supporting their nurses to get certified. They're a big magnet facility. That goes into exactly this slide here. I became certified first as a CEN, and then as I was given the TCRN exam certification since I sit on the committee. When it first started, I was one of the very first item writers. And then the CCRN exam. Each one of those I wanted so that when someone sees my credentials, they know that it validates my knowledge and my skills to them, saying that I know emergency medicine, critical care, and trauma. It holds clout with your peers. If any patients know what it means, it holds some clout and gives them a little bit of a little relaxing sense, because they know that you know your stuff, right? But certification is great for validating your knowledge and your skills, not only to yourself, but to everyone else, right? I also wanted to prove to myself that I could do these certification exams. I'd heard how hard they were. Some people I'd hear they didn't pass it on the first time, so it makes you a little nervous going into it. But as you're studying for it, it also helps you beef up your own knowledge, because like I said, when you're doing these questions and you miss one and you look at the rationale, you retain that information more. The impact that certification has is, I know physicians that look at certified nurses with a little bit more confidence. Again, that's not saying that if you aren't certified, you're not a great nurse. That I know nurses that have been nurses for 30, 40 years, and they have more knowledge than anybody I've ever met. For some reason, they don't necessarily want to get certified. They don't want to do it, and that's fine. But do it for yourself, do it for your facility, do it for your patients. Perks of certification. This is outside of the pediatric ER at Loma Linda in Southern California, where I work. And these are some great peds nurses. So I already kind of talked about this with the valuation of certification by certain employers. When you work at a magnet facility, in general, magnet promotes certification and professional, advancing your professional career. At my old facility in Ohio, some places do annual bonuses. We got an hourly raise. They paid for our exams, so they fully compensated us for that. We would actually, on Certified Nurses Day, we would have specialty lunches. So they would have a luncheon for anybody that was certified. And then we got our names on a plaque. We also were getting, you would get things from different organizations once you're certified as well, which is really nice. So it really helps if you work for an employer that values that. When you guys are going out looking for your jobs as new nurses and new grads, that's something maybe you should, I always suggest talking to HR about and just saying, how do you guys promote professional advancement, and what do you offer your nurses to help them advance their careers, whether it be certification, tuition reimbursement, stuff like that. And anybody that says they really promote and they really support certification is a corporation that really supports their nurses and really shows that they value advancement of your knowledge and stuff and those type of things. Maintaining your BCEN certification, I touched on it. The CEUs to recertify kind of require you to stay up on best practices. That validation of knowledge kind of helps you step up the level of care that you give. It helps you be a better advocate for your patients, because you know what to go to that physician and say, hey, can we try this instead of this? Once you've worked with these docs and you're certified and you've got that validation, a lot of times they take your recommendations with a little bit more confidence. That is me as a baby ER nurse, by the way. To be a successful trauma nurse, there's characteristics that you need as a nurse in general, right? Any patient you have, you want to anticipate their needs. This is incredibly important in a trauma bay or in the critical care phase of trauma, because you hear a mechanism of injury, right? You hear they got stabbed in the back or they got shot in the abdomen. Well, you have to be able to understand what injuries that mechanism can cause. So if maybe you need to have the chest tray out. So maybe you're thinking, okay, this could go bad. Let's have a thoracotomy tray out just in case. The EMS reports that they've got decreased breath sounds. Well, let's go ahead and get a chest tube tray out, have the chest tube stuff set up so that we can make this as seamless and as efficient as possible. That's really important as a trauma nurse, because the trauma surgeons are going to come in. They may say, hey, let's have all this stuff set up, but you're like, hey, I already got it done. The patient comes in and you already have the knowledge of what you think could potentially happen. A big thing that I try and teach in all of the nurses that I precept, or any new grad that's or new nurse into the trauma bay, is that taking control of the room and managing chaos is very important and is very much the role of the primary trauma nurse. You have to be able to work in a very high stress situation where a patient comes in talking to you. Maybe they've torn the aorta, they all of a sudden bleed out, and now they're in a traumatic arrest. So now you have to be able to switch from that just talking to the patient to now you're having to resuscitate them. Always stay calm. Anybody notice that when you walk into a room and someone's super amped up and they're really they're yelling and they're hot, everybody else goes to that level. So keeping everybody calm is really important too. So when you guys are first coming out of nursing school and you're getting your first job, if you're in an emergency room, or if you have the opportunity to really go and observe a trauma resuscitation in a trauma bay, watch and see who is who is up here and who is down here as far as staying calm. And you will notice a huge difference in how it actually helps things go better. Most trauma nurses have a type A personality. They like to do things themselves. You have to be able to handle death in a, professional manner and not, it always takes a toll on our mental health as well. It's sad. It's not something that anyone wants to have to be around, but it is part of our job. And, you look at what happened with COVID right now, where ER critical care nurses were seeing so much death. And a lot of people say that's what you signed up for. Well, as a trauma nurse, if there's any major disaster, a natural disaster or a mass casualty situation, you are going to be the nurse that is going to help deal and help resuscitate and help manage those sickest of those sick patients, right? And then given that situation, you look at what happened in Las Vegas and Orlando, these mass casualty situations, that those trauma centers are going to get overwhelmed, right? So you need to be able to go in, deal with this trauma, and be able to step out and take the other trauma. Or you may have to deal with two traumas at the same time, trying to chart and just keeping yourself focused and making sure that the patients are taken, the best care is given to the patients that you can. Sometimes that requires mass casualty triage, which is never a good thing to have to do, but it saves more lives. These pictures here are of me doing just a few things that I like to do. The softball and the volleyball, I was younger in my earlier days of my career when I was less thick and more agile. But one of the blessings, I live in Southern California right now, and that's one of my best friends. We went to Stagecoach. So one of the nice things is I live 20 minutes from Coachella and Stagecoach. So these big music festivals, really important to have things to take care of yourself, whether it be the gym. I love to eat. I love gym. I do enjoy high-end bourbon, but just finding time to take care of yourself and how to deal with your stress in a healthy way is really important to be a trauma nurse. So advice I give to all of you guys as new nurses and just starting this career, it's an amazing career. I highly recommend everybody go that's trying to think of something to do. It gives you a great purpose. It really is like a mission. You get to do some amazing things and help people in such awful times in their life, and you get to be that person that can hold their hand or calm them down or be a really calming voice to them. And the great thing for right now during COVID is a lot of times there's not family or friends or no visitors. So you are that person that they're going to look to help decrease their anxiety, to help talk them down off a ledge when they're really freaked out about what just happened to them, or having to deal with the loss of a limb or loss of function. You as the nurse can be a beacon of light to that patient, and you can really change their life, not just from the clinical care you give, but from the support you give. Never stop learning. I don't care if you've been a nurse for a month or 20 years, always be a sponge. There's always something new to learn. There's always something. Never walk into a situation thinking you know everything. Even if you are pretty confident about what's going on, always go in and listen to people, listen to those physicians, listen to the nurses that are experienced, and you can always learn something new. I still learn every single day I'm at work, whether it be a new medication that I've never heard of, so I look it up. Whether it's, when all these travel nurses come through different facilities, especially now with COVID, every hospital does something different. They have different processes, they have different practices, they use different protocols, and by getting to experience different facilities like that, you can also, picking the brains of these travel nurses, you can hear what some places do that works and some places do that doesn't work. Just really stay up on your game. Always read, subscribe to journals, listen to podcasts. There's always such great information out there that's new. So I now get to introduce Sherry Flores. So she's going to be talking about the CPIN. She's a good friend of mine and very knowledgeable. Thank you guys for letting me talk. And if you have any questions, we'll see you at the Q&A.
Thanks, Brody, for that amazing introduction. I am so excited to come to you today. My name is Sherry Flores. I am coming to you from Phoenix, Arizona. And I'm going to talk to you a little bit about the certified pediatric emergency nurse and my path to that process. I hold several academic degrees, but I have said from the beginning of my career, all the academic degrees have gotten me is more significant student loans. What I am most proud of and what I identify most with are my certifications, because I feel like that's a personal goal and commitment for myself. So again, my certifications mean a whole lot more to me than I actually have in my academic degrees. So to become a nurse, I didn't do it the easy way. I went into engineering first. So I went into aerospace and engineering at the University of Minnesota. And about 3 years in, I realized I'm not an engineer. I'm different from this engineer type. And I transitioned into nursing. I had a background previously as an EMT. And so it was a natural transition to pick something in healthcare when I decided engineering wasn't a good fit for me. I finished with my bachelor's of science at the University of Minnesota, go Gophers, and continued through my academics. I started off getting a degree or an advanced degree, a master's degree in nursing education from Indiana Wesleyan University. At that point in time, I was a travel nurse, and so I wanted to try to get my career set and my feet solid. I moved into leadership and realized I couldn't talk the financial speak as a nurse. So I was running an emergency department, but I couldn't get the funding that I needed. So I recognized I needed to be able to speak finance. And the best way for me to be able to do that was to go back and get an MBA, which was the hardest curriculum that I had taken because it was so foreign to me. There was not a patient-based scenario ever, and I had to learn how to work with ledgers and Excel spreadsheets to be able to get that degree process. Most recently, I am in a doctoral program for an executive leadership doctoral degree, which is very exciting to think about. I am on a current pause because of COVID. We weren't able to go in to finish our clinical practices that we needed to be able to do. So that will be coming up in the near future for me. My actual walk will be in June. All right. So why did I go into nursing? I kind of told you a little bit. I went into emergency medicine first. I went in as an EMT because I really was drawn to a woman named Dixie McCall. And I'm dating myself very quickly because most of you have never heard of this show, but there was a show called Emergency, and it was about the first paramedics in Los Angeles County and how they were able to start to practice off protocols. They did their first EKGs in the field and transmitted them to a hospital called Rampart. And I just thought Dixie McCall was the coolest person on the planet. And I really wanted to be exactly like her because the physicians at Rampart, as well as Dixie, they all work together as a team. Definitely something that I wanted to be a part of. So kind of my driving forces to be Dixie. And my locker for several years, people would put Dixie McCall pictures all over that. During my academics, my undergraduate degree, I had many doubts that nursing was what I wanted to do. I think the most crazy moment for me was during a behavioral health rotation. I went to a state hospital in Minnesota where they practiced electroconductive therapy or convulsive therapy, and they would throw people into seizures. It was a pretty archaic experience for me to watch. It freaked me out quite a bit. I didn't understand the pathophysiology of the why. I kind of just got thrown into a room to watch a procedure, but no one debriefed me. No one set me up for success to say, hey, this is what you might experience. After I saw that, I literally wanted to just run. I was not going to be a nurse. There was no way I was going to do this for my career, but an amazing instructor who recognized my basically traumatic moment, my stress and my crisis. And she was kind of able to talk me down about that process and that procedure. It made a huge difference. So as I continued and my clinicals, I did fantastic, but then I had the academic program behind it and I hit statistics. I had always done calculus and advanced math, but I had never done statistics. And I couldn't get that application process down. I actually failed statistics twice. I failed it. And had to reprioritize, had to get a tutor, had to learn to study and think about statistics much better than I was doing. But the third time was a charm and I was able to pass, and the rest is history. I do use statistics often. So it really, that intense time to learn that process has really set me up for success now in my doctoral degree, because I have to do a lot of statistics and analysis at this level that I wasn't prepared to do at that point in time. Kind of gave you a little debrief on this. I, in high school, had a health occupations semester where we could either choose to be a nursing assistant or choose to become an ENT. And they gave us the opportunity and talked to us a lot about what that would look like. And the CNA component of it, we had to go into nursing homes, and that was our clinical practice area. The EMT component, we got to ride on the ambulance and go hang out in the firehouses. And you can probably tell by my personality which one I chose. So I went for the EMT thinking I never wanted to do anything in nursing or being a nursing assistant at all. So the irony in all of that is this is exactly where I ended up. After nursing school, because I went to the University of Minnesota and they helped pay for my academics, I actually got a job as an extern, but now they call them RN residents at the University of Minnesota. And I got thrown into the pediatric oncology and bone marrow transplant. So it was a pediatric critical care service area. And I learned immense. I went from giving like 3 medications through my entire nursing school, and I kept my nursing flow sheet from my very first day. We did 57 medications by 12 noon on my day shift. So it was intense. I had amazing mentors who all this time later, almost 30 years later, I am still friends with on social media, which is ridiculous. I actually got a text message from one of them this morning to say, hey, good luck. And thanks for doing what you do for pediatrics. So that consistency, that team, that family that's built in pediatric nursing is huge. So what would happen is if they had a pediatric code in the emergency department, they needed the critical care pediatric nurses to respond to the codes. So I became part of the critical care pediatric team off of my bone marrow transplant ICU experience and kind of got hooked back into emergency medicine. I realized that I liked that intensity. I liked the unpredictability, but I really did love critical care. My husband at the time got relocated for his job to Louisville, Kentucky. I had grown up in Minneapolis my entire life. And so he moved us to Louisville and I was devastated. I did not want to go. I did not want to leave my job I had worked so hard for. So I went and got a job at the PICU at the only pediatric hospital in Louisville. Hated it. It was not like where I was from and didn't really know how to grow forward. I had a very closed mindset, not a growth mindset at that point in time. And I just was ready to throw in the towel. So I applied to a community hospital that was a little bit closer to my home for a general pediatric floor. And during my interview, the human resources person said, hey, we're starting a pediatric emergency department. Is that something that you would be interested in? Because I see that you were an EMT. I left the pediatric specific hospital in the region to go to an emergency department, but I had never been an emergency department nurse before to help them grow that first pediatric emergency department. I loved it. So I absolutely clung on to that experience. I learned a ton about emergency nurses, some of the certifications like PALS, ACLS, BLS that come with that process. Quickly after that transition, I actually got divorced. And so I became a single person in my mid-20s and decided that Louisville, Kentucky wasn't a good match for me. So I went to work for Yellowstone National Park as a backcountry rescue nurse, again, focused in pediatrics, and then started a travel career. So I worked in a lot of different states, about 32, including the Virgin Islands, and then also did some time in New Zealand and Cambodia as a pediatric nurse. So got a really vast exposure to pediatric nursing in all those different areas and absolutely loved it. Flash forward in my career, I came back stateside, went to Phoenix, Arizona as a contract nurse, got dropped into an interim role as a pediatric ER manager here in Phoenix, ended up staying, transitioned to helping a pediatric trauma program run. And then now my current job title is clinical education as a pediatric specialist for my hospital facilities. What's the best part of my job in pediatric nursing? It's never the same every day. That's the component of the emergency room. You just have no predictability of what's going to come in. You have to learn to be extremely flexible. Many times my patients would come in critical condition, and we'd be able to help get them to their next step, hand them off to ICU, help in that rehabilitation standpoint. But I could watch a patient who probably shouldn't have survived thrive. And so that's a very motivating factor. I still keep in contact with many of the patients that I've taken care of, and are now watching them head off to high school and picking colleges. And I think if I wasn't part of their life, they probably wouldn't have made it to that point. I really like sleuthing. I like being someone who can help in the discovery of what's happening for a patient. So I like to be able to diagnose the unknown. I am really not happy if I get a patient that already has a diagnosis, because then I already know what recipe card to pull and what I need to be able to do. In the emergency department, they haven't gotten a diagnosis yet. So you're really looking at a blank canvas about what you're going to do for intervention and treatment. And you really have to be able to be flexible to kind of help out. For me, my current passion, what I love the most is our therapy dogs. And I know they're here for our patients, but really they're here for me, but really they're here for our staff. One of the things I want you to know about pediatric emergency nursing is it's not always happy. It can be a little bit unpredictable, a lot of bit unpredictable, and there can be really sad points. It's not always joy balloons and confetti. I've shed thousands of tears with my patients' families, and with my peers at the stretcher side. You need to know as you come into emergency medicine, whether your focus is trauma, flight, general emergency, pediatric emergency, transport, whichever realm that you do, you need to understand you're never going to master this beast of emergency nursing. If you go to ICU and critical care, you're going to lock in really quickly and be able to master that area. But because we have such diversity in our patients, in our experience, in our shifts, you become the jack of all trade, master of none. And you have to be okay with that if you come into emergency medicine. You're also going to meet people on their very worst day. They might not be nice to you. They might not say really empowering things. Very rare that the emergency department gets flour and cookies from their patients. You'll see that on other units. The other thing that you miss a lot of times in the clinical setting, kind of coming up in your nursing education to pick emergency nursing, is you miss what I call the butt crack sweats. So you are in lead, you are fully covered because they're shooting x-rays all around you. You're resuscitating a patient who is dependent on your knowledge and skill, and it is hot. Those trauma bays for resuscitation are kept about 82 degrees because if you have a spinal cord injury, if you have exposure of your skin, you will lose body temperature very, very quickly. One of the areas of specialty I have is pediatric burn, and those patients will lose body temperature so fast that we keep the room miserably hot. And you are wearing heavy lead, and you are going to sweat in places that you had no idea you even had sweat glands to sweat. Butt crack's one of them, but there's some other places too. So once you're in pediatric emergency nursing, which I think everybody should do, if you're moving forward and you want to go for your certification, my recommendation, and this is what I tell everyone that's in my circle, just pick a date. Whether that means putting a calendar on the wall and getting a real life dart with like the sharp point and throwing a dart at a date at the calendar. Pick a date, circle it, register for that date, and then tell your people. Whoever the people are in your circle, tell them you're going to do it. Post it on social media. Have people outside of your immediate family hold you accountable for that. And then take advantage of your time. If you are a parent, oh my goodness, you spend so much time in drive-throughs and car lines. If you are not a parent, you're still spending a ton of time in places. So you're at the drive-through for your burger and you got to wait 10 minutes. That's 10 minutes of prime time to either flip through some flashcards. There's some apps you can get for your phone that will help you be able to review. My significant other loves movies that I might not enjoy as much. That's a great time for me to review. Why did I go for certifications? Because I already had this academic degree. Why did I go for certifications? Number one, they're passports. Many times in travel, you think, I want to go to this country. I want to go experience this experience somewhere outside of the United States. But to get there, you have to have a passport. You have to leave your comfort zone with a passport to go somewhere else. That's what a certification does. You can pick amazing goals and dreams. Hey, I want to go work for the second largest burn center in the country. But to get there, you have to have a passport because you have to leave your comfort zone. So that certification puts you above the rest of the people applying for the job because it shows that you're a content expert. It shows that you have put in the time and commitment above the standard. You're not just punching a time clock, you're putting in the time. And it shows that you're dedicated to actually reach your goals. So, what does certification do? Biggest thing is peer trust or peer recognition. When you're in a group of nursing, especially in the ER, you might start a shift depending on the size of the ER you're at with 20, 30 people. If you're one of the only people who hold that national certification, you're going to you're going to get trust within your peer group very, very quickly. That's going to come with opportunities for you. It's going to come with increased connections. When opportunities come at a national level, if you work in a large organization and they need a representation of an emergency department, they're going to pick someone with certification to go first. My current employer, I work for Common Spirit. We have 158 hospitals within our hospital system, so lots of opportunity there. They'll give us 100% reimbursement for any testing fees, studying material, review courses. It puts us on a clinical ladder. So there's 3 rungs on a clinical ladder. The top 2, you have to have a national certification to get to. It allows me to be a preceptor, which comes with a financial compensation, but to precept, I have to have a certification. And I might be chosen first to do outreach activities and get to go cool places. 158 hospitals in my division or my region, I am able to go lots of places to help them. Why do employers like them? Number one, cutting edge practice. If I'm recognizing my providers are doing things that maybe don't meet the national standard because I'm reviewing at a national standard concept level, I am very strong into evidence-based practice because I'm ready for those certification exam questions. I need to know what we do at a national level and not just local. Pediatric nursing versus adult nursing. What do you need? You need to be a change agent. Pediatrics, there's not a ton of research because it's really hard to get IRB approval. And so we're learning consistently as we go. So you have to advocate. You have to be in your national organization saying, what are we doing in other places in the country? And what can we bring here? Got to be wicked smart because pediatric patients don't present the same way adult patients do. And 95% of your curriculum in nursing school is adult based. So they're going to kind of break the mold of what you are trained to be able to do or moving forward. I spoke a lot about things that you'll take in and that your brain will process. Your brain's not able to differentiate if you're experiencing it or you're watching it. So if you're watching that pediatric code, your brain may interpret that as you're actually living that pediatric code. So you have to have a really good balance of life. I have 2 biological children and I have 5 bonus children. So I have a total of 7 kids in my family. So we are crazy. We're like the ultimate Brady Bunch. I have a banging husband who is fantastic. And he understands. He's somebody that I can debrief with when I come home after a bad day. He's very good at being able to listen. That's an important person to have if you're going into healthcare. And I'm a coach for Little League. I coach a female softball team for Little League. We're pretty awesome. We put a lot of time into it, but I'm able to take my clinical practice, saving lives of children, and actually go out in my community and help empower girls to grow forward, not just on a softball field, but as better people, to help them build confidence and to help them grow forward. So even if I'm not in a clinical setting with peds, I surround myself with that outside of the hospital. So as I'm wrapping up, they wanted me to give you some advice. And I wish I had the perfect words of everything you needed to hear. Biggest thing that you need to know, for me, emergency and trauma nursing, especially pediatrics and pediatric burn, was the best choice I could have made. It fits me. I identify with it. It is fully who I am. But you gotta know, if you choose emergency medicine or pediatric emergency medicine, you're gonna be thrown into chaos. It's hard. It is hard every single day. You're gonna laugh. You're gonna cry. You're going to do things at work and have emotions that if I was an accountant, if I worked at a coffee shop, if I worked in retail services, I probably wouldn't have that same exposure experience. Because of that, nurses in general are 10% more likely to contemplate suicide because of stress than our peers. So that's just one of those blunt statements to throw out there to say, hey, this is a reality. It's the real deal. This is something that could definitely happen for you. Some people aren't able to quite shake that off and need to have some help to be able to do that. So even though it's the greatest decision and the best decision I could have made for myself, it's changed me as a person. I can tell you, my godchild is a pediatric ER nurse. My niece is a pediatric ER nurse. I have started a little ripple trend because it is such an amazing impact and such an amazing career. Only 3% of nurses across the country are pediatric specific emergency nurses. 3%. How awesome to be part of that group and to make an impact on the most amazing treasured population of patients that we have in the emergency setting. I wish you all amazing journeys. I cannot wait to hear some feedback about things that you've experienced in the next 5 to 10 years of your career. And maybe even this conference has been a catalyst or a springboard to help you make some of those choices. So I appreciate the time that you spent with me today and letting me share my story with you. I am super excited to introduce to you Austin. He is coming up, amazing person. You're going to love to hear his transition as well in nursing and the processes that he chose to take for certification. So thanks again, and I hope you guys have a fantastic day.
Thank you, Sherry, for your information on the Certified Pediatric Emergency Nursing certification. Super helpful. People who take care of kids are super cool. So my name is Austin Johnson. I am a critical care transport nurse who lives in South Florida. Got a couple different certifications there, but today I'm going to focus on the Certified Transport Registered Nurse credential. So we're going to start with, why did I choose nursing? And I like to say, it sounds cliche. I think nursing chose me, really. I used to watch a lot of the shows on TV, like he says there, that the doors of the ER would burst open, somebody like is rushed in on a gurney, and there's somebody on top of them like doing CPR. And I was like, oh, I want to do that. That looks so cool. But at the end of the day, it is the unique blend of health sciences and human touch that really made nursing the career for me. It's not even really a job at this point. I attended Broward College here in South Florida, graduated with my associate's degree in 2014, and then went on to do my RN to BCEN degree from Florida International University in 2016. So I was working while I was working on my bachelor's degree on the side. For me, nursing is that combination of an art and a science, where that physical and emotional care that you give to somebody, there really isn't a job like this. So anything that I could do to get into it, I was like, I'm going to do it. Doubts and discouragement. It sounds so scary. But most of my discouragements actually came from before I got into nursing school. As I was growing up, there were those people who like, you would in middle school, like color with like a dark red crayon on the outline, and then you'd color it in with like a lighter. It just looked so nice. It looked perfect. These people like thought about stuff. It was like, I don't think that's me. So I thought that perfect grades and all the extracurriculars were required. And I heard that it was really competitive. You know, how am I ever going to get into that? And I kind of put myself down from the idea before anybody else had ever really told me that I couldn't do it. So not feeling like I measured up to the standards, I had to sit down and think about how am I actually going to do this? Because I knew I wanted to, but I felt like maybe I couldn't. Sat down, took a bunch of extra classes, really tried to boost my GPA as much as I possibly could. And it kind of polished off my resume to the point where I felt comfortable applying and got it. And it was like, oh, well, maybe I shouldn't have actually been that scared. But I do feel like the preparation suited me because it made me better for it. It kind of gave me the discipline I would need to get through it. The path to transport nursing. Transport nursing is both a combination of every specialty before it and a specialty on its own. So I felt like while I was going through nursing school, I had a lot of friends who were like, oh, labor and delivery is definitely the thing that I want to do. I love it. Or pediatrics or whatever the case might be. And even some people walk through the emergency room and they're like, oh, I love this. But every single time I walked past a specialty, I was like, I like all of them. How do I find a way to take care of a pregnant mother who gives birth, take care of the baby, take care of a child, take care of an adult? I want to be able to do all of it. So transport nursing really is critical care in the fast lane. It's critical care, but make it faster. I wanted to be able to spin the medical surgical roulette wheel in my head and be like, you never know what's going to come in that door. So you got 4 rooms in the ER. Each one is so different. And I wanted to be able to experience all of them together. The most rewarding part of my job is knowing that I make a big difference in the life of others. And I know that sounds really cliche, but it's true. We do meet some people on the worst days of their life, but also some of them finding out that they're pregnant for the first time. You know, it means a lot to these people. For me, I'm going to work and I clock in, but there's something else to it. There's that extra layer of it. It's not just my job, it's my life. Like, you know, you can't really take the nurse out of you, even if you clock out. So it kind of actually makes a big difference in my personal life too. Tough days ahead. What's the tough part about this job? It is physically and emotionally draining, almost regardless of whatever setting you're in, whether you're in the medical surgical units and you have 7 patients, or you're in the ICU and you have 2. You can't even weigh them together. They're all physically and emotionally draining. So you have to really have your self-care strategies in mind. You have to be your number one priority. Preparing for the exams. So I've taken a few, at least 7. And I would say BCEN makes it pretty simple for their purposes. There's 5 different certification exams. Which one do you work in? You should probably go for that one first, or the most widely applicable one for your setting. And they give you a lot of resources like the BCEN exam reference lists. You can literally go and buy the textbooks from the people who are the experts in that field. If you're studying for the Certified Emergency Nursing credential, the CEN, then where would you want to learn about burns from? Probably the American Burn Association. It just makes sense, right? So BCN knows that. They go to the contact experts and they make sure that what they're building for these exams to make sure that we're on top of what we're doing comes from the people who put together the research, who put it forth, who study it. And that's really vital, not only in your practice, but also for the exams. You can go to the research partner organizations. That's the Emergency Nurses Association, ENA, ASTNA, the Air and Surface Transport Nurses Organization, and the Society of Trauma Nurses, because they put out that literature. They make sure that we get it. Even if you order on Amazon, I'm sitting down and I can read these books and I'm like, oh, cool. I have like a direct connection to what's going on. Once you get a good handle on the book knowledge, you can sit down and start taking some of the practice exams to kind of see where you're at. BCN obviously has theirs. You know, you can use theirs. You can take the classes in burn care, stuff like that, to see if you're ready. Oh, this is actually a good memory. Back in nursing school, for our final proposal presentation, we talked about getting certified after we got out. And so a friend of mine did critical care, a friend of mine did labor and delivery, one did the operating room because she was a surgical tech before. And I was like, I think I want to do the emergency room. And they're like, yeah, that's kind of suits you, because they knew that when I walked to the ER doing my preceptorship, I was like, oh, this is cool. I want to do this. This is fun. And I actually presented on the CEN. I remember sitting on BCN's website going, I want to do that one day. And then it turned into, I'm going to do that one day. There's no real reason why I couldn't. I thought I couldn't even go to nursing school. And I'm sitting here in my last semester. I was like, oh, I want to do that. So it was kind of a goal that I set even back then to do this. Why did I do it? People think I'm crazy, but really it was to prove to myself that I have what it takes to do the job regardless of where the setting is. So I'm very proud to be one of 66 nurses that have all 5 BCEN certifications, and they mean a lot to me. I didn't get them all at once. I got them as I naturally moved through those different settings. I actually achieved my TCRN in trauma first. It was right after it just came out. I was working in a trauma step-down unit. And I was like, okay, yeah, that makes sense. It's natural. It's a progression. I can do that. And then I moved into the emergency room. I was like, okay, now we can do the emergency one. And then it just kind of evolved from there. I started doing pediatrics because even in an adult setting in the ER, I still took care of children. So I was like, okay, well, like I should probably make sure that I know what I'm doing there too. Then if somebody else has a child patient come in and they're like, ooh, I kind of need some help. I'm like, oh, I can help you because I feel more comfortable with that. And then as I moved into flight, fixed wing flight, and then into ground transport, I was like, okay, it's just natural progression. We're going from 1 to 5 real quick. I think probably one of the best ways to describe it is that each of those certifications is a physical check mark for your skills and knowledge that are up here. So as you go through them, people can look at them, whether it's your employer, it's your colleagues, they see that you took an exam, you passed a bar, and it shows that you have it. It's in there. You can help them. It literally certifies that you kind of know what's going on, that you're up to date. It's that you can help other people. I just think it's really cool. So the impact of certification, other than the fact that it makes me feel like I did it. I knew I could do it. I sat down, I learned everything I could, even in things that I never thought that I would try to get certified in. I didn't think I was going to step outside of there and go for pediatrics. And then I did, and I was like, okay, I can do this. There really is no reason for me to try to stop myself. There's no one else trying to stop me, But overall, the certifications themselves, they strengthen my resume because all those letters on the top make people a little bit nervous. Positive employer impression for interviews because it's at the top of your resume right before you even walk in there. They kind of know what's going on. They know that you've put in the work, regardless of how long you've been an emergency nurse, whether it's 20 years or not. You took it seriously. And then it became a resource for my colleagues. It's really true. When a really sick patient comes through those doors and your partner looks at you, you're like, I'm coming to help you. If you have that nurse's intuition that something didn't seem quite right, something might be wrong with that person, they're probably gonna be like, hey, come with me. I want you to take a look at this. They look okay on the monitor, but something else is going off. And you can kind of sit down together and go through it and see if there's anything else that you can do. So my employers have always valued certification. They actually have a confidence in you, whereas if their orientation schedule is sometimes shorter or longer, depending on how you're doing, they're usually pretty confident that your orientation won't take as long because they're like, okay, you kind of are up to that standard on what we've got going on. So you may not take as long to get through it or something like that. It may impact your pay rate. They can give you an incentive bonus tacked onto your hourly rate, which is nice. Actually almost every place I've ever worked, our yearly evaluations actually had a spot for, will go on and get their specialty certification. It means a lot to the hospitals too, because it makes them look better by association or, wherever that you work for. Because they're like, look at us, we have board certified nurses, so they're as excited about it as we are. So how do my employer and my patients benefit from my certification? They look at, for example, in this picture, me holding a little baby, he can't read it, but his parents looked at my scrubs. It says I was a flight nurse, and it says that CFRN, the first thing out of their mouth is, what's that stand for? And it's certified flight registered nurse. And they're like, so you know how to do this? And you can answer confidently, yes, I do. Even though I'm holding a baby, they don't care about the kids stuff. They're like, okay, so you have what it takes to do this. And I'm like, yes, I do. To maintain those, the CE hours, the 100 CE hours that you need every 4 years, they're like, you're keeping up to date on the newest information, the newest medications, the newest disease states, especially now in the evolving times of the coronavirus and COVID-19. As things change, these newest CEs that come out, we're learning more about it. Not only how to treat it, but how to protect ourselves, protect other people, things of that nature. that best evidence that they keep giving to us, we learn more and more, whether it's about a new medication, a new practice, something else to watch, a new piece of equipment. It definitely benefits them because it just shows that they're getting the best care that's possible. The employer should feel confident because it means that we are up to date, unless, depending on where you get your CEs from, it should be the newest research on the newest stuff. So we're kind of always on top of the game. So characteristics of a successful transport nurse number one is adaptability, because you literally never know what's going on. I've gotten in the back of that truck before, and 5 minutes later, I'm in a hospital putting a heart monitor on a pregnant mom. And then the next one is an intubated trauma patient. And it goes back and forth, and you never know what's going to happen next. So you really have to be ready for anything, but then once you actually get there, you kind of have to wipe everything else away and deal with what's in front of you. So it's be on your toes, but ready to dig your heels in when you need to. These are some great memories, but it's all about self-care and managing the stress of the job too. You have to make yourself a priority. Yes, you could pick up an overtime shift if you want to, but at the same time, doing that over and over again, messing up your sleep and your eating and all that kind of stuff is not great in the long term. You're going to hurt yourself. So you need to value your rest. Make sure that you have plenty of personal time so you can actually sit down and just breathe for a second. Surround yourself with those that you care about, like my friends here in this picture. A lot of them emergency nurses that do the same thing as me. So we all got to do it together. And it's okay to sit and do nothing. I'm doing it right now. A little bit of advice. On the left is all the jobs that I've had, and I think I worked like 3 of them at the same time. Not sorry about it. I enjoyed what I did, but I still had to make sure that I had time for myself. Every little thing that you do is part of your journey. Time spent as a nurse outside of your department will make you a better nurse all around. When I didn't start brand new hire in the emergency department, I was like, some other people got into it. So that kind of made me feel like maybe they're better than me, but I had to stop myself. I'm like, no, you don't talk to yourself like that. Like you're going to learn something. I went into a respiratory trauma step down unit where people were intubated all the time, got central lines. We did a lot of really high intensity acuity procedures at the bedside. And everything that I learned from there, I walked in the emergency room. I was like, oh, I know what's going on. I've taken care of these sick people before. And I thought it was great. Everything that I learned, all those experiences were actually extremely valuable. It's it for me. Thank you all for your time. Thanks to all the other presenters. So we're going to go back to Janie, finish this up.
Wow, thank you so much, Austin, for that awesome presentation. Austin representing our CTRN credential. What an amazing presentation. Thank you very much. And thank you all for joining us today to review this session. I hope that you'll be able to join us for our live Q&A session on April 8th. It's going to be from 3 to 4 p.m. Eastern Daylight Time. We really look forward to seeing you there. And that will be your opportunity to interact with myself and our panel and ask any questions that you might have. You can ask us anything about career paths, certification, the Advantage program, anything you'd like to know will be at your disposal, and we're really excited to get to interact with you and answer your questions. Thanks again for attending our session, and we hope to see you on April 8th.